welcome everybody to tonight's forum. Thank you so much for being available to join with us. We didn't expect to be having another forum like this, but we're grateful to Dr. Simon Crouch and Professor Rhonda Stuart for running another forum for our community. Obviously, we have had some news that has made us rethink our plans going forward. So we have lots of questions. I've seen those already on the question document, so thank you for putting your questions there. We hope that we can get some of those answered and get some direction, some clear direction for us going forward. So thank you to all of you for your efforts so far. I'm just going to share the screen and with you and just start us off with a acknowledgement of country. In the spirit of reconciliation, we acknowledge the Boonwurrung people as traditional custodians of this land. We pay our respects to their elders, both past, present and emerging, who are the knowledge holders of language. We extend that respect to all Aboriginal and Torres Strait Islander people present. And a prayer to get us started. We stand together. We pray for all who are in quarantine, suffering and affected by coronavirus. At this time of sorrow, incomprehension and tragedy, we stand together. We pray for God's mercy and healing and for the health and strength for all who care for them. We ask this through Christ our Lord. Amen. I'd like to welcome Simon and Professor Rhonda.
Thank you. Thanks, Jennifer. And good afternoon, everybody. Here we are again. As Jennifer said, I guess we were hoping to give the news that we would be able to downgrade the rest of the school, apart from the couple of classrooms already identified. But unfortunately today we had another couple of cases become positive in the school. And what that means for us is there's been an enormous amount of testing, and we really appreciate everybody going out and getting tested, because that's the way we're going to find cases. And we've only found 2 cases out of all those people that have been tested. So that's really good news in a way. It's a bit unfortunate that we have found 2 extra cases, but that to us means that there is still a risk if people are out of isolation and they may become positive in the next week or so. So for that reason, we are making the school remain a tier 1 site, meaning that people will remain in isolation, the children will remain in isolation, and those under the same roof as them will remain in isolation for the full 14 days. So 14 days after the last time they were at school. I understand it's a difficult time for people, but we really need to be aware that the virus can transmit quite rapidly, and the best way to do this is by stopping people moving around if they have the virus. So this is why we're going to keep this process going for another week and a bit now. We, as I said, a lot of people have been tested, so that's amazing. Really appreciate everybody going out and getting tested. What we do know too is that there might be some children who are asymptomatic or have very mild symptoms since their last negative swab. And we would encourage people to go and get another swab in the next couple of days, because if any of the children are positive, not only would that actually help us identify if there was any more risk in the school, but it also may mean that until waiting for another week, it might mean they come out of isolation a week earlier, in fact, if they were positive now, rather than waiting for another week to find out they'd actually had the virus for a week. So it's not mandatory to have the test in any way, but we would encourage everybody to go and get that test. It will give us an information about if there are any more cases, and it also gives it information, give you the information if your child has the virus, then they will know when the day 0 starts for them from having the virus itself, because we do keep people in quarantine for about another 2 weeks after they're positive for the virus. So I hope that makes sense. As you'd be aware, in the community, you know, the numbers are increasing. We're getting control of it. Lots of contact tracing happening. Most of the cases now that we're finding, as we found with these 2 new children, are already in isolation, so we're not finding more exposure sites. But for these 2 children that we've found, potentially they may have been infectious the last day of their schooling. So, you know, there could be some new cases developing or have developed since those children were swabbed. Again, it's really only the children that need to be swabbed, because if they're negative, their parents won't have caught it from them. So I really focus on getting those children swabbed. But of course, anybody who has symptoms should go along and get a swab. And, you know, I'm sure you all know where all the swabbing sites are now after having thought about this for the last few days. I think that was the main thing I wanted to say. But Jennifer, I think you might have some questions you want us to answer. Oh, you're on mute, Jennifer.
Okay, thank you, Rhonda. I'll share that question document with everyone now. So let's just share that. I'll just enlarge it. Okay. So it looks like someone's popped a question right up there on the top. And then we've got some questions below that if you are able to read those, Rhonda.
So I've just taken my child to get their second COVID test as requested by the school. Can the secondary contacts leave the premises and stay elsewhere until the primary contact gets a negative result? So if the child is negative, then those secondary contacts, if they're not living under the same household, will be able to be released from quarantine. But as soon as they move back into the household, they will be back in quarantine for the remainder of that child being in quarantine. Does the immediate retest apply to pupils only, or every person who entered school during exposure period, e.g. parents and siblings who picked up from after school care? Look, I think the highest risk here, and the risk is low. We've done a lot of testing. You know, all the students have been in the school. Most of them now have had a test. So the risk is low if we've only found an extra 2 so far, but the risk would remain highest for the children. So I would concentrate on getting the children tested, and if any of those children come back positive, then we might expand further, but it's really the children that would be at the highest risk. How many families have not been contacted by contact tracers? Simon, are you there?
I am here. So as a public health unit, we have personally contacted the highest risk children, as we'd spoken about previously, in grade 4. We work with the Department of Health and the surge teams that are available there, and a number of the school community were referred to those surge teams, and so I would have to check in to see how they've been going, following up with those lower risk families from the other grades. Good point about the aftercare. So we will follow up on that and make sure that we've captured people who have been exposed in the aftercare setting if they haven't been captured so far. So I'll follow up on that.
And the two new cases are not actually from grade 4, they're from a different class. So this is the reason why we're expanding, not just to keep the grade 4s locked down, but to expand it to the rest of the classes as well. The 2 new cases are not household contacts of the previous positive cases, and at this stage we don't know the exact link, except they're both from the same school, but we are not aware that they know or are good friends with the first cases. If the kids are symptom free and staying in isolation for 14 days, is it mandatory to get another test now, or can it wait until day 13? So it's not mandatory to get a test now. You can wait until day 13. But if you wait until day 13 and your child tests positive, there is a certain amount of time that they may need to be in quarantine until we make sure they're not infectious. Whereas if they're tested now and we find that they're positive, the clock will start ticking from the time the test is positive, not until we wait for another 7 days. I hope that makes sense. Our family's not been contacted by the department yet. All family members have returned COVID negative swabs. We'd like to apply for an exemption to leave home as their parent passed away. Okay, so Simon, do you want to answer the question about not being contacted by the department? We're not contacting everybody, are we? We're just sending text to the majority of people.
So as I mentioned, the surge staff are working through those lists. I think it's fair to say that there are some 16,000 primary close contacts currently in Victoria. And so they are working through, as I mentioned before, with the highest risk groups first, and then working through that. So we can certainly look into that, and maybe Jennifer, if you can provide us with the details of this family, particularly as they're keen to apply for an exemption, that is something that we can help facilitate.
The 2 new cases, when were these tests performed? In the last 24 hours on the same day they were asked to test. Now, these became symptomatic, and so they went and had a test yesterday, and that's the results have come back positive today. Trying to understand why I would have to get my child retested when their test was negative. So the whole idea about getting a retest is to see if somebody may have come up positive. So we do know children may have very mild symptoms and may have no symptoms actually. If we find out they're positive now, it may mean they get released a lot earlier than waiting for another 7 days. So the whole family would get released a lot earlier too, because if you're in the household with somebody who's positive, you have to wait to be released. You've become a primary close contact of them, and you need to be released. You have to wait 14 days after they've become less infectious. So you can imagine if we wait till day 13 to get your child tested and they've actually had the virus for a while but haven't been symptomatic, they then need to be cleared, and you start your isolation from that time when they're cleared. So it becomes this rolling time of longer and longer isolation. So this is not mandatory at all to get a test now, but if on the small chance that your child does come up positive, it will mean that everybody in that family household will be released from isolation at least a week earlier. Testing is compulsory. So, I mean, we can't make anybody have a test, but if children don't get a test and they don't get that day 13 test, then we require them to stay in isolation for another 10 to 14 days, just in case they've picked it up and are possibly still able to transmit the virus. So we will not be sending anybody back to school who potentially could have the virus. They will need to remain in isolation. If they don't get that day 13 test, we have to presume that they could be infectious. What evidence do we need to carry to go to a retest to avoid being fined for being out of quarantine? Simon, do you know that answer to that question?
So going to get a test while you're in quarantine is one of the few reasons why you can leave quarantine. Emergency care is another. And so you don't need to have any particular evidence on you. You just need to, if you do get stopped and asked why you're out of quarantine, you can say, I'm going to get a test, and that will be fine. Then you'll be allowed to go and do that.
You don't need to only go to Wellington Road, Clayton. We suggest Wellington Road, Clayton, because that's got 6 lanes, and it actually in the last few days has been the one with the least waiting time. In fact, yesterday it was down to about 10 minutes. So you can go to any site that's handy for you, but you might want to look at the waiting times on the website as well. But from experience in the last few days, our Clayton Road testing site has been the least waiting time there. It's really important to keep confidentiality. Simon, what do you think about the class here, year level?
So I think you may have mentioned the year level already, Rhonda. So I can't remember actually. Different grade to grade 4. But I think it's the important thing here is that it's increased level of risk for the whole school. So knowing that a lower level of interaction between the original grades and the new kids means that there is that higher risk, I think, across the whole school. We're assuming that interaction has taken place perhaps in the playground or maybe in the restrooms, and obviously any of the kids could have been exposed in any of those sites.
took my children and myself to be tested on Sunday as they both developed a cough. Is this counted as a second test result? Results were negative. Do I need to go again? So I would just be a little bit wary about one swab coming back negative if the children still have symptoms. We are seeing that occasionally the first test is negative and then the second test is positive. So if they do have ongoing symptoms, I definitely would get retested. But again, if they have their day 13 swab and it's positive, the isolation clock starts ticking again. So just keep that in mind about not getting further swabs. We're confirming it is not compulsory or mandatory to have this test at day 7, and it's not compulsory or mandatory to have it day 13. What will be required of you if you don't get that day 13 test, your child does not get that day 13 test, is a longer time in isolation. The students who tested positive are mildly symptomatic and have been just for the last day or so. If a student has a chronic nasopharyngeal condition non-compatible with a COVID swab in the nose and mouth, where can we do a serological? So we don't do serological tests or stool tests for this virus. There is a saliva spit test available, but it's not as sensitive as the nose swab. If the child does have a nose condition, we can just do a swab. Well, most of the swabs now are just a deep nasal swab. It doesn't go all the way back, and we can sort of do around the back of the tongue. So it can be done without using the swab right back to the back of the throat and nose. You're right, the Department of Health hotline is not answering. There are, well, they're trying to answer all the calls, but there's a huge number of calls when you think about 16,000 people in isolation and all the calls that it itself would mean. If you've got any particular questions you need to ask, then we can even answer that if Jennifer wants to send us an email about that particular concern you have if you need it answered and the hotline's not answering. Here you go. On the 16th, Simon said this virus is very virulent and spreads quickly, and I said kids will have a mild disease. The strain doesn't make people particularly sick, but is spreading more easily. Can you update us on that? So what we mean here is that this virus, this strain of virus is spreading very quickly. It's not particularly causing people to be a lot sicker, but it's spreading very quickly. So that's what I think Simon Winner meant by the virulence. It's just able to transmit very quickly. You know, we're seeing it transmit within 1 to 2 days, whereas previously it was more like 5 or 6 days that people would become symptomatic. So it's able to spread from person to person much more quickly, and that means a lot more people are becoming infected in a shorter period of time. And what we don't want to get is a lot of people being infected, because that is when we'll start seeing people needing to present to hospital. It's not particularly the strain that's making people sicker, it's just making more people infected. Did you want to add anything to that, Simon?
No, I think that was good.
Able to share. So, and everybody wants to know what the year level is. I might leave that to the school to decide if they want to do that. It's all about confidentiality here, and it's not a grade 4 class. So, but there is another class affected just in one classroom. But it's really, we want to make, you know, we want to maintain confidentiality of the students, and I think that's an important thing. If the school wants to declare which class it is, that would be up to them. Informations clearly state whether just St. Pat's students will be tested or the whole household needs to be tested. So the whole risk here is with the students or anybody who came to the class or in the school. So if we need to concentrate on those people at risk. We don't need to test the rest of the household who weren't at the school, because they can only get it when they're in lockdown from that child who is there. So we test the child who's been in the school. If that child is positive, then the rest of the household, of course, will need to be positive. But the most important person that needs testing is the person that's been to the school or the person that's symptomatic, because potentially they could have got it from somewhere else as well. Can all families at St. Pat's expect to hear from the department? Yes, as Simon said, because you're all tier 1 now, there will be eventual calls, but the system is trying to keep up with all the close contacts at the moment. Is there any new advice relating to secondary contacts who had been in contact with prior to our isolation period and negative? Simon, do you want to answer that question? I can't get my head around it.
Yeah, so I think this question is asking if you were previously a secondary close contact and have been separated as appropriate, then what happens? So I think, as Rhonda had said previously, if a primary close contact has had a negative test since that separation has taken place, and so their secondary contacts are now out of the household, they will have been cleared and they're clear to go about their own business, and this higher risk that we've attributed to the school won't affect those people at all, as long as they don't go back to that household. So shouldn't have any change from what the information we provided to those people previously.
What will be the process when we return back to school? How will the school be advised that students are able to attend after receiving negative results at the end of the isolation period? So everybody who's in isolation will be advised themselves about going back to school. Once their result is negative, they'll get the advice that they're allowed to go back to school. And the school will be notified, of course, if there's any positives, but the process will be that at the end of the 2-week period, most people will be coming out of isolation. My child had a second negative result from a test on Saturday. Does she need to be tested a third time? Nobody has to be tested, but please, if she has symptoms or you're concerned that they may have become positive, then get another test. But if, as I said before, if she potentially is positive today with no symptoms and we wait another week, it's delaying the release of isolation from not only the child, but also for the rest of the family.
I might come in on this one, Rhonda.
Yep.
Obviously, there's a lot of questions around the year level. So I've had a brief consultation with my leadership team, and we will announce that the 2 new cases are in the grade 6 level and 1 in each of the classes. So,
Rhonda, I might also pop in there and just provide a slightly different perspective on that. I know people think are seeking this because they would like to have a better understanding. I think the important thing to reflect on is that the fact there has been transmission from the original cases into another year level, it doesn't really matter what that year level is. What that shows us is that the whole school environment is at risk. So just that you are aware that it's grade 6 these new cases are, it doesn't mean that if your child is in grade 2 or grade 3 that they are at any particularly lower risk. We're classifying the whole school now as the same sort of risk. So it shouldn't change the way that you're undergoing your quarantine or the vigilance you should have as a household.
Thank you, Simon. Yes, that's right. What about the last question, Simon? Should an employer avoid collecting work documents given they are in isolation?
The answer is they probably should. If they are very essential, important, urgent documents that have to be collected, then there are potential ways of putting them into a safe, secure place outside and having completely contactless and making sure that whoever's picking those documents is using appropriate hand sanitation, etc. So the preference would be to avoid people coming to the house, but obviously sometimes there are emergency reasons why this happens to happen. And so complete contactless, no face-to-face contact, and it should be okay.
Thank you. Oh, are there more questions?
No, I think that's it. That's it. That's the end of our question document. So thank you. And I want to agree with Simon around that point about the year level. We don't actually know, where or how the transmission has taken place. So it could be that, it could happen in any of our other levels. So yes, that's really important to understand that. Thank you, Simon and Rhonda. All right, is there anything else that you would like to share with us before we finish?
No, I don't think so. Just, a reminder, there's been a couple of forums with different schools as well. You're not the only school going through this. We understand it's really difficult, but there are many schools and many other people going through the same thing. So it's just about, teaming, getting together and working through it and, you know, we're just trying to all get rid of this virus from our community. So if this is what it takes to be in isolation for a few more weeks, I think that's the aim.
I might just add one more thing, Rhonda, just because I understand that there is potentially some people from the school who have kids in other schools in the area. We are going to be putting out a message in relation, I think it's called the Dendy Interschool Sport. Just we think there is incredibly low risk in relation to that particular activity, but we are going to request that people who are at the boys' football match do get a test. So there may be some parents on here who have kids at some of those other schools. I don't quite know what the spread of schools are. So you may receive a message from the school coordinator from those other schools just asking for that child to get a test. That is just a test, and it's not requiring the full 14 days quarantine. So if that child has moved out of the household with the primary close contact from St. Patrick's, then that child is just a test and that's all they need to do. So I just wanted to flag that because I know that there is some crossover between schools and families in the area.
Great. Thank you very much, Simon, and thank you, Rhonda. Appreciate your time and being here for us and supporting our community and answering all of those questions. I'd just like to reiterate and say thank you to all of our school families and to our staff and to the community who are supporting all of us as well as we get through the quarantine period. So we will continue to keep each of our families in our prayers. I know that some of our families are going through some really hard times with, one with a member of their family in hospital, another who's one of the children, their grandfather has just passed away. So there's so many things that we need to keep in mind. So thank you so much for joining us. I have recorded this session, and once it's processed, we'll put that up for you to listen to again. Thank you everyone for your time tonight, and stay warm. It's actually the best place to be inside with all that rain out there. Thank you very much, and we'll be keeping in touch.